Hello everyone, welcome to the Newgen Innovators podcast. As promised, we keep on showing ourselves again and again with a good dose of thought leadership initiatives. And today I have with me our healthcare BU head, Manish Jaiswal. Well, be prepared to learn a lot about what's happening in the healthcare payers industry, to understand how Newgen is progressing, making waves in this industry, and of course the products, the platform, the solutions that we have to offer, and not to miss the overall industry knowledge that we will gain from this episode. So welcome Manish, how do you feel? You've come all the way from US, you're here for a series of meetings, you look probably a little drained, but then your energy is infectious and we can't do much about it. So how do you feel about the day and the time that you're spending here?
Thank you, Runki. Thank you very much, and thank you for hosting me here. Of course, always it's a pleasure. Last time when you were in US, and it was our honor to have you there. And now we are in your beautiful office. Looks great. Everything looks fantastic.
Well, it's our office. It's Newgen office.
Of course,
yeah.
But I can see your signature. It looks pretty decent. So thank you for hosting us. Clearly, I'm extremely excited to be part of your series where the leaders have been speaking about on various topics. And today, if we're going to talk about American healthcare and the role of Newgen and how we are shaping things in America for Americans and for the folks back home, it'll be an honor to talk about it.
Well, then Manish, let's get the camera rolling.
Sure.
The way it happens is that I usually get a set of questions from our viewers and I handpick them. And I'm going to throw these questions at you one after the other, and you're expected to be in the best of your decorum, the best of your knowledge space, and help us garner some knowledge or help us with some enlightening answers, rather. Okay, so here comes the first one. So what's the core value prop that we have for healthcare payers, particularly to the US market?
So US, first, let's talk about the entire American healthcare landscape, right? I mean, it's the largest, as we have spoken multiple times. It's $4.8 trillion and counting, and which makes it bigger than the GDP of India, if you were to look at it, right? So this is humongous industry, perhaps the largest. And if this was a country, so to speak, then it would have been the third largest country. And give and take, about 18% of GDP of America goes into American healthcare. And when we say American healthcare, people do get confused about that. Okay, how does it make it so big? So we have classified it into 4 buckets. P1, payers, also known as health plans. P2, providers and health systems. P3, pharma life sciences. So folks do relate between P2 and P3 because that's universally true across the world, whether you're living in London or in France or in Africa or in India. Of course, you have hospitals, you have pharmacies, pharmaceuticals, drugs manufacturing, and so on and so forth. And the 4th P is platform and product companies like ours. So we'll speak about all of them. But going back to the first part, because you talked about payers, and which is health plan, which is a little different from other industries or within the industry of insurance in the world. We call it payers because everything is literally paid for. If you compare and contrast with Indian insurance would be more indemnity side of it. Should you fall sick? Should you go to a hospital? Should you have an insurance? The insurance company or TPA will pay for it. But thankfully in the United States, because of maturity, because of the depth, and over so many years, the industry evolved in such a way that it became payers, which means everything is paid for. Of course, as long as you're covered, right? You have to have insurance, whether individual insurance or government insurance, which is Medicare, Medicaid, or collective insurance. There are various types of insurance, but as long as you're covered. So those are the 4 Ps which covers the American healthcare in the landscape. For most of the folks who may want to see and understand, that makes it the easiest way to look at it. The 4th piece is us, which is Newgen. We are a platform company. We are essentially AI first platform company. And what our story is in US is pretty much nuanced to healthcare side of it. And you know it, that, Newgen is into various other industries. We are in fact, we are leaders in banking. We are fairly decent in the insurance side of it.
Absolutely.
And as a BU, healthcare is the new one, but we have a fairly decent track record based on our learnings and experiences and success across the world. American healthcare and Newgen in the healthcare space is equally, I would say, good and relevant.
So what's the core value prop that you have if you have to categorically call out the payer side of healthcare?
So our core value is in our horizontal platform, which is the typical R, ECM, BPM, CCM, which makes it different from, it's not a space which is very crowded. We are not in the retail side of software. We are not on the services side of the software. We are on the enterprise side of it, which means a large hospital system or a large payers, typically you're talking about multi-billion-dollar companies. These are the one who needs an enterprise software to support the core functions related to, say, enterprise document management or low-code BPM platform.
Understood.
Or communication side of it, right? Within healthcare, everything is HIPAA-driven. You just can't communicate the way we want to communicate, like typically you and I are communicating right now. So if you're talking about any PHI, we're talking about anything related to any individual health has to be within the format of the PHI. So those are our software which caters to that segment. That's a core value proposition.
Okay.